Hi guys, welcome to our another thorax anatomy lecture. So today we're going to talk about the esophagus, the anatomy of the esophagus. Right, so the esophagus is a structure of the GIT, the upper portion of the GIT, which is a continuation of the pharynx at the level of C6, right, or the lower border of the cricoid cartilage, right, and then it ends by piercing the cardia portion of the cardiac portion of what of your stomach. So the esophagus, if you're gonna look at it, it's gonna extend from the lower border of the cricoid cartilage, right? And then it's gonna, if it is in the thorax, then it's gonna leave at the esophageal hiatus. Remember the esophageal hiatus that is made by the right cruise of the diaphragm, right? So it's gonna be 25 centimeters long, 25 centimeters long, right? And it's going to be divided into three parts. You're going to have a surgical part, a cervical part, with the one that lies within the neck, and then you're going to have the thoracic portion, which is the longest portion, and then you're going to have your abdominal part, which is the shortest. So your esophagus is found in both the superior mediastinum and the inferior mediastinum, right? So in the inferior mediastinum, remember the inferior mediastinum is going to be divided by the heart being in the mediastinum of the inferior mediastinum, and then your thymus and other sternopericardial ligaments are going to be in the anterior mediastinum. And then as for the posterior mediastinum, that's where we use the pneumonic ducts, the descending aorta, the esophagus vein, the thoracic duct, the esophagus, and the sympathetic trunks. So the esophagus is found in the posterior mediastinum of the inferior mediastinum, right? So what is important is to take note of the the esophagus on these levels, right? So in the cervix, in the cervical part or the upper third of the esophagus is gonna have its own relations, right? So the upper third is the one that will lie in the neck. We're gonna do it when we do here the neck, but it's important just to appreciate that anterior to the esophagus, you're going to have your trachea, as well as um, your laryngeal, your recurrent laryngeal nerve, your left recurrent laryngeal nerve. Remember the left recurrent laryngeal nerve that is given as a branch of the left vagus nerve that walks around the ligamentum arteriosum, right? And then it goes upwards, right? And then it will be lying between the trachea and the esophagus via a groove between the trachea and the esophagus. Remember, right? Uh-huh. So that's gonna be your anterior relation. So even in the superior mediastinum, those are going to be your anterior relations, right? Um, you're also going to have the 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 left main bronchi, right? Being in the anterior aspect, you are also going to have the arc of the aorta, right? These are the structures that are also being in the anterior compartment, anterior to your esophagus, right? So what is important? Let's take a look at the esophagus, right? So the cervical, we are done with the cervical. The thoracic now, thoracic you said is in the superior and the inferior. In the inferior is going to be in the posterior mediastinum, and anterior to it you're going to have the following. You're going to have, we already spoke of the right main bronchi, the left main bronchi, right, as it forms a constriction, the second constriction of the esophagus, as we're going to talk later. And you're also going to have the pericardia of the heart. The pericardium of the heart, more specifically, it's going to be your oblique sinus. The area of your oblique sinus is the one that will be separating your left atrium and the what and the esophagus right here, right? So the esophagus is going to leave the thorax via the esophageal hiatus. So let's look at it. So the esophageal hiatus is going to be 1 inch away from the midline, and is going to be surrounded by the left cruise, the right cruise, sorry, the right cruise. So this right cruise does not form an anatomical sphincter, it forms a physiological sphincter. So the lower esophageal sphincter is a physiological sphincter that is made by the right cruise of the diaphragm. Take note of that. It's not anatomical, it's a physiological sphincter. And this is at the level of T10. At the level of T10, right? Remember, it will be together with the right and the left vagus nerve, as well as the epigastric, lymphatics, and so forth, right? We are going to talk about it later. Okay, so the esophagus is going to be divided into three, like we said, um, and it's going to have three constrictions. So you can actually see that this is your esophagus, right? These are the structures that are anterior to the esophagus. You have the trachea, you have the arc of the aorta, you have the left brachiocephalic. You also have the pulmonary trunk, the left pulmonary trunk, as well as the left main bronchi. The left main bronchi. So the esophagus has three constrictions. These constrictions, they are clinically important because they are going to be sites where most um, esophageal carcinomas are going to be found. And also, if there is lodging of a foreign body or let's say something that has been swallowed, they are more likely to stay or to reside along this constriction site. So the first one is going to be at the opening of the esophagus, right, as it continues from the pharynx, right here. The second one is going to be made by the left main bronchi. So as the left main bronchi crosses the esophagus anteriorly, it's going to be in close relation to the esophagus, forming what? The second constriction right here. And then you're going to have another constriction right here that's going to be made by the right cruise of the diaphragm. That's what we said. It's going to form the what? Remember the what? Aha. It's going to form the physiological sphincter of the lower esophagus, which is the lower esophageal sphincter. It's not an anatomical sphincter, right? So as the esophagus is going to uh, trans transit right from the neck to the abdomen, it's going to receive blood supply that is different depending on each part. So in the cervical part, right, it's gonna be supplied by the inferior thyroid arteries, right? That will be coming from the second part of your subclavian artery, right? So the inferior thyroid arteries, they will supply the first part of the upper part of your esophagus, which is the cervical part. As for the mid part, which is the longest, that is the thorax, right? The thoracic portion of your esophagus, it's going to be supplied by the bronchial arteries coming from the descending aorta. So remember, the descending aorta or the thoracic aorta is going to also give esophageal arteries that will what? That will supply the esophagus, right? And then in the lower part, which is your abdominal part, which is we said that's the shortest part, and that is about 1.3 centimeters long. Um, that is gonna drain into the what or enter the cardiac portion of the what of the stomach. That portion is gonna be supplied by what you call esophageal branches that will be coming from the left gastric artery. So as you're gonna look at the abdominal esophagus in the abdomen, you're going to understand that we have what's called the celiac trunk. The celiac trunk is gonna give what's called a left gastric artery, and that left gastric artery is gonna give esophageal branches that are going to supply your abdominal portion of your esophagus. What about venous drainage? So the veins, they correspond to the artery, right? So the cervical veins, the cervical part is going to be drained by the inferior hypogastric veins that will drain in the brachiocephalic right veins, right? As for the thorax, they're going to drain into your hemazygous vein in there and the azygous vein. In the abdomen, the abdominal portion, the veins, they are going to drain into the left gastric vein. In the abdomen now, it's very important because the lower esophageal portion, the lowest part of the esophageal portion, which is the abdominal esophagus, is going to be associated with what we call portal systemic anastomosis. That the veins of the that drain the lower part of the abdominal or the abdominal esophagus. They're going to be communicate. They're going to communicate the portal system as well as the system of veins. So the left gastric vein is going to be a tributary of of the of the portal vein, but you're also going to have tributaries of the esophagus vein that will also be draining the lower portion of the abdominal esophagus. So if there is what you call liver cirrhosis or fibrosis of the liver, there's going to be hypertension in the pulmonary vein, and this hypertension in the pulmonary vein is going to lead to what you call esophageal varicocele. These esophageal varicocele, they're going to appear in the lower portion of the esophagus, and they can, in severe cases, they can they can uh these varicocele, they can bulge, right, and then they can lead to what you call um hemometasis, right? Hemometasis, that is vomiting of blood, and if it prolonged, it can be very fatal and it can lead to death. So that's what is important. These are the clinical potency of the abdominal esophagus, right? So what about the lymph drainage? The lymph drainage, right? So in the cervical portion, the cervical part of the esophagus is going to drain into the deep cervical nodes. The thoracic is going to drain into the mediastinal lymph nodes that will drain into your broncho mediastinal lymph nodes, then lastly drain thoracic duct. As for the abdominal portion of the esophagus, it's going to drain the left gastric lymph nodes. The left gastric lymph nodes will drain into the celiac lymph nodes, right? So that is very important. Um, that's the important things that you have to understand about the esophagus, right? So let's now take a look of the venous, the nervous supply of the esophagus. So we have what called the esophageal plexus, right? That is the sympathetic portion will come from the upper four sympathetic trunk, right? Which is upper four thoracic sympathetic trunk together with the splenic nerve that will supply your sympathetic, right, innervation of the esophagus. As for the parasympathetic innervation, depending on the part of the esophagus, the thoracic part, the cervical part is going to be innervated by the left recurrent laryngeal nerve, that one. But as for the thoracic part, it's going to be innervated by the left and right vagus nerve. And the left and right vagus nerve are the ones that are going to give, like that are going to live together with the esophagus at the esophageal hiatus, remember, at the esophagus hiatus, right? And you're going to have your left esophageal, you're going to have your left vagus nerve being anterior, while it's your right vagus nerve being posterior. And these, when they enter the abdomen, the abdominal part of the esophagus is not supplied by the vagus nerve, but rather is going to be supplied by the anterior and posterior gastric nerves. Why? Because these gastric nerves, they're going to be formed by, for example, the anterior gastric nerve is going to be formed by the left vagus nerve, mainly by the left vagus nerve, and a short supply from the right vagus nerve. So it won't be right to say that the abdominal esophagus is going to be innervated by the vagus nerve, the left vagus nerve and the right vagus nerve. We have to specify that they're going to be gastric nerves. You understand? Aha. So that's what is important about the esophagus. So thank you so much for listening. See you next time.